Hi, everyone in quarantine. This is Dr. A with your Chapter 11 lesson from the U.S. healthcare system. We're going to talk about healthcare law. Okay, so some of our learning objectives. We're going to describe the legal relationship between a patient and provider. We're going to apply civil and criminal liability concepts to healthcare providers and consumers. And we're going to discuss the importance of the original patient bill of rights. All right, so did you know the Ethics in Patient Referral Act of 1989 was passed because providers were referring patients to medical services in which they or family members had financial interest. So they were like, oh, go see my brother, the cardiologist. You need a referral to go see them, right? The big conflict of interest there. In response to the Affordable Care Act anti-fraud initiatives, over 15,000 Medicare providers were expelled from the system for fraudulent activities. So Medicare and Medicaid fraud is a big thing. The most important relationship in the healthcare system is the relationship between the patient, the healthcare consumer, and their provider, which could be a physician organization such as a clinic or a hospital where the physician has a relationship. So to be an effective healthcare manager, it is important to understand the basic legal and ethical principles that influence the work environment, including the legal relationship between the organization and the consumer, which is the healthcare provider, and the patient. All right, so let's look at some basic concepts of healthcare law. So first of all, law is a body of rules for the conduct of individuals and organizations. It is often interpreted differently and it may change over time. It is created so there is at least a minimal standard of action as required by individuals and organizations. And it is created by federal, state, and local governments. As the judiciary system interprets previous legal decisions regarding a case, they are creating common law. So the interpretation of the law in a case is common law. And often, so your bare minimum standard is going to be the federal. Sometimes state can be more strict than federal, but state has to follow the minimum of the federal, and of course the local has to follow the minimum of the state and the federal. So the minimal standards for action is federal law, although state laws might be stricter. So sometimes there are some things that can vary from state to state, which still abide by the federal law, but just each state gets to decide how strict or lenient they're going to be on certain things. Legislature creates laws that are called statutes. Both common law and statutes are then interpreted by administrative agencies by developing rules and regulations that interpret that law. So for example, when the Affordable Care Act became law, put into place, then Medicare and Medicaid, CMS, developed a bunch of rules and regulations to comply with the law. All right, so in this first open-ended question, list an example of a healthcare law. So some more basic concepts of healthcare law. So there are civil and criminal laws that can affect the healthcare industry. So first, let's start with civil law. So it focuses on the wrongful acts against individuals and organizations that are based on a contractual violation, which means you had an established contract, or there was an established contract between the patient and the provider, and one or both, or somebody violated that contract. Torts, or is derived from the French word for wrong, which is tort, really, if you say it properly in French. They're a category of wrongful acts that occur in civil law, but they may not have a pre-existing contract. Now, to prove a civil infraction, you do not need as much evidence as in a criminal case. Criminal law is concerned with actions that are illegal based on court decisions. So, for example, if you had a surgeon that performed a surgery on, they were supposed to maybe operate on the right knee, they operated on the left knee, you could sue them. That could be under civil law, right? Because you had a contract to operate on one knee and he did it on the other, so in a way he violated a contract. So that would be a civil lawsuit. Criminal law would be something where, for example, Medicare, Medicaid fraud will fall under criminal law if, as a provider, you are charged with HIPAA violation. That would be criminal also. So in order to convict someone of a criminal activity, it has to be proven without reasonable doubt of guilt. So again, examples are of criminal infractions would be Medicare fraud as an example. Okay, so approximately how many people die each year due to medical errors? What is your thought? 10,000, 50,000, 100,000, 250,000? If you're near pod, answer that. And let's talk about medical malpractice. So according to the American Heritage Dictionary of 2000, medical malpractice is the improper or negligent treatment of a patient by a provider which results in injury, damage, or loss. According to the Institute of Medicine's landmark report, To Err is Human, medical malpractice has resulted in approximately 80 to 100,000 deaths each year. Disputes over improper care of a patient have hurt both providers and patients. And patients have sued physicians because they feel their provider has not provided a proper level of care compared to the standard of care in the industry. And they may be right, or maybe they're wrong. Maybe the physician did abide by the proper standard of care. They just think they just should have done more. And so this can be things where, a procedure was done that went wrong, and then the physician is sued. Or it could be that somebody forgot to give a patient a critical medication and this ensued harm to the patient of some sort, right? So there are 80 to 100,000 deaths a year for that. That's a lot. According to Bell, the injured patient must show that the physician acted negligently in rendering care and that such negligence resulted in the injury. So to do so, there are four elements, legal elements that have to be proven. One, there was a professional duty owed to the patient by the physician. So, maybe again, in our case, the physician was supposed to fix their right knee, and instead they went and operated on the left knee. Okay, so he had a duty to do what he had contractually agreed to. There was a breach of such duty. So again, negligence or wrongful act or something like that, something that he did that violates the contract, violates the agreement, or the normal assumed duty that the provider has towards the patient. That injury caused, there was an injury that was caused by this breach, so violating that caused injury. So obviously if they operated on your left knee instead of your right knee still messed up. Now your left knee has been, altered in some way, and this can result in damages and stuff, right? So you have, damages because of the injury. Money damages, if awarded, typically take into account both actual economic loss and non-economic loss, such as pain and suffering. Economic loss could be, for example, you were not able to go to work for, I don't know, X amount of time. Plus, you also have to have maybe the other knee fixed or something like that. All right, so let's look at basics of healthcare torts. So negligence involves the unintentional act or the omission of an act, so forgetting to do something that would contribute to the positive health of a patient. So you either unintentionally harmed your patient because you forgot something. Omission would be forgetting something, or you unintentionally did something that, again, affected them. An example of negligence would be if a provider does not give appropriate care or withholds care that results in damages to the patient. So for example, if you are a caregiver and working in a nursing home and you're supposed to feed a patient and the patient gets their meal and they can't feed themselves, and you forget to feed that patient, and then their food gets taken away, having not eaten, then you can contribute to the harm, because eating would normally contribute to the positive health of the patient. Now the patient's starving, and even if it was unintentional, you just forgot, it still has caused us negligence to that patient. Intentional torts are things like assault and battery or invasion of privacy. In the healthcare industry, an intentional tort would be such as assault and battery, for example, would be our example of a surgeon performing surgery on a patient without his or her consent. And so there's some gray areas there, but you have to obtain consent, if at all possible, before you do any kind of procedures to any patient. All right, so on this one, just give me what is an example you can think of negligence. And you can think specifically to your chosen field of for your practice healthcare field. All right, so tort reform. So as a result of the number of malpractice claims in the U.S., malpractice insurance premiums keep increasing, and therefore providers have started doing what we call defensive medicine, which means that they order like a battery of tests trying to cover absolutely all their bases to protect themselves from malpractice lawsuits. And sometimes it can be a joke even among providers or at least healthcare workers, especially with ER physicians. It's like, oh, you come in and stubbed your toe. You've got to have an EKG and all these other blood tests. You came in and because you passed out, oh, you have to have an EKG and all these other blood tests and some imaging and stuff like that. You know, oh, you have diarrhea. You have to have an EKG and all these blood tests and stuff. And so that's defensive medicine. ER physicians are really widely known to do that. More states have adopted a statutory cap on monetary damages. That means they're limiting how much money a plaintiff can get in a malpractice claim. So because the because the malpractice insurance premiums have been going up, they figured that, oh, if we put a cap on how much has to be paid out, then it could slow this increase in the malpractice premiums that these insurances are charging to the physicians and stuff, and trying to, because that in turn, of course, increases the cost of practicing medicine, increases healthcare costs. So there are, however, many legal factors that have contributed to this increase in claims. For example, voluntary hospitals are no longer exempt from malpractice suits. Therefore, you have employers now have to take the responsibility for the employees' wrongdoing. That has also increased claims. So for example, if you combine both of them, if you were a hospital employee, a nurse or something, and you made a mistake and the patient sued, they can sue the hospital, and the hospital is liable for your mistakes. The concept of informed consent also for the patient has expanded and therefore increased claims. And so we're going to talk about informed consent here in just a minute. And the acceptable standard of care, which used to be strictly based on a locality rule, so simply, you know, whatever is normally done in a certain area, it has now become a state or national standard, which also has resulted in an increased amount of claims. Recent federal studies have indicated that imposing caps on awards may be an effective method to reduce malpractice costs and to discourage frivolous lawsuits, but there's still a lot of, it's not exactly as clean cut as they think it is. The U.S. Supreme Court ruled that any awards must be included in an individual's tax income, which means then you would owe taxes on it if you got an award as a plaintiff. I do want you, I'm going to link this, want you to watch this video on tort reform. And then we're going to move on to the relationship between the provider and the consumer. So a physician can establish a relationship with a patient in three ways. You can establish a contractual relationship to care for a designated population. So they are caring for all the enrollees of a specific plan, right? Especially like we see in managed care. You can establish an express contract with a patient under a mutual agreement. So you go see the physician for services, and you usually have sign some papers, again, establishing this contractual agreement between you and that provider. And you can establish a relationship also under an implied contract, meaning if you come, for example, to a physician and you talk to them and you ask advice and they give you advice that can impact your healthcare, then you have this implied relationship that has started. So the relationship between a patient and a hospital, a contractual right to admission has been considered a contract if a hospital has contracted to treat certain members of an organization, for example, like a managed care organization. A second example of this type of contractual right to admission is if government hospitals, such as county hospitals, are required to provide care for a patient regardless of ability to pay. Then there's automatically a contract that they have to care for that patient. So a contract to care for a designated population is usually indicative of an HMO or a managed care contract. A physician is contractually required to care for those members of patients of a managed care organization, especially as long as that physician is in the contract with the managed care organization, and then those patients are part of that managed care organization. Again, an express contract is a simple contract, is merely a mutual agreement of care between a physician and a patient. The physician could define the limitations of the contract, which could include parameters of care. So it could be an extended contract, so especially between you and your primary care provider. You establish that contract when you first go see them, and a lot of times we don't read through them. But one that would be, for example, that would be limited is if you were referred to an orthopedic surgeon for a surgery. Your contract would probably just limited to, the pre-surgical stuff, the surgery, and then the post-surgical stuff, and then the contract would end sometime after that because you don't need to be constantly under their care. An implied contract, again, can be implied from a physician's action. If a physician gives advice regarding a medical treatment, then there's an implied contract. And this is where you will often see this disclaimer. So any information out there on the internet, especially on YouTube or on Facebook or in podcasts and stuff, often have these disclaimers saying the information on this YouTube channel is not intended or implied to be a substitute for professional medical advice, diagnosis, and treatment. All content, including text, graphics, images, and information contained and or available through this channel is for general information purposes only. This channel makes no representation and assumes no responsibility for the accuracy of information on or available through this channel, and such information is subject to change without notice. You are encouraged to confirm any information obtained from and or through this channel with other sources and review all information regarding any medical condition or treatment with your physician. There you go. That should be on any kind of medical type of channel or podcast and stuff. So let's see. EMTs bring a patient to the ER who is in cardiac arrest. The ER team starts working on him immediately. The contract between the ER physician and the patient being cared for would be a contractual relationship, an express contract, or an implied contract. Which do you think it is? All right, how does a relationship with a provider ends? So to protect a physician from being accused of patient abandonment, the physicians have to take steps to properly end a relationship. So yes, a physician can end a relationship with you for various reasons. And sometimes it might be referred to like, oh, the physician has fired you as a patient or something like that. Because they could do that if you're completely non-compliant, you won't do anything they say and all that, they can't end that relationship. So, but if the patient withdraws from the relationship with the provider, then the physician no longer has a duty to provide follow-up. So if you all of a sudden quit going to see that physician, they haven't seen you in years, then they're pretty much automatically released from that. Also, if medical care is no longer needed, the relationship is naturally completed. That would be an example with the knee surgery, osteopathic referral. If it's to fix a certain problem and that problem has been fixed, you've had the follow-up and everything's back to more or less normal, then that is a natural completion of a relationship between a patient and provider. The AMA provides the following 5 steps for a physician to terminate a relationship with a patient. So first, you want to give the patient a written notice, preferably by certified mail or something where they have to acknowledge receipts. Then provide the patient with a specific reason for the termination. So it could be they're completely non-compliant with any of the advices, but what about if the physician is relocating? They might be relocating to a completely different state or something like that. Continuing to provide care for a reasonable period of time so the patient can find other care. Right, so okay, we'll see you here for another month or whatever. We'll see you for X amount more days or months until you can transition to a different primary care provider. A lot of times they'll go ahead and list some primary care providers that might be able to take that patient on. And then it can also offer to transfer all the medical records with the patient permission to their new provider. Again, so this was another one on malpractice and physician communication. This is really a good video. I'm going to link it below. And it's in your Nearpod, so you can play it. And so, have you ever felt that the doctor or healthcare provider treating you was not listening to you or did not care about you? So it's a simple yes or no poll. And let's look a little bit at healthcare related legislation. So healthcare consumer law. So first we have the Hill-Burton Act of 1946. Federal grants were provided to states for hospital construction to ensure that there were 4.5 beds per 1,000 people. So this spurred the growth and development of a lot of hospitals. Then we have the EMTALA Act of 1986. It requires that Medicare participants receive emergency care for a life-threatening condition from a hospital or medical entity that provides dedicated emergency services. Facilities can be fined thousands of dollars for not adhering to the EMTALA. So they cannot refuse treatment to patients that are in an emergency situation or in active labor. The Children's Health Insurance Program Act, or CHIP, was enacted under the Balanced Budget Act of 97. It is Title 21 of the Social Security Act and is jointly financed by federal and state funding and administered by the states and the CMS. The purpose of this program, again, was to provide coverage for low-income children that were younger than 19 years of age, whose family income exceeds the income level requirements for Medicaid, but there are still some income requirement levels. They're just a little higher. They can make a little bit more money than is required to qualify for than the threshold for Medicaid. The threshold for Medicaid is pretty low. Benefits Improvement and Protection Act of 2000, formerly called the Medicare, Medicaid, and SHIP Benefits Improvement and Protection Act. It modified Medicare payment rates for many services. It added coverage for preventive and therapeutic services, and it increased federal funding to state programs. And then the HIPAA, Health Insurance Portability and Accountability Act, national standards. It was passed in 2002 to protect a patient's personal medical records and other personal health information that was maintained by healthcare providers, hospital insurance companies, and health plans, especially when all of this went computerized. And then all of a sudden, a whole lot more people had access to your health data. So before the 2000s, I mean, there were some computers, but everything was just kind of just local. And a lot of your medical records were just really on paper. So for a person to have access to it, they have to physically get your chart, and that was a lot harder to do. All right, so some of the antitrust laws. So the purpose of an antitrust law is to protect consumers by ensuring there's a market driven by competition, so consumers have a choice for healthcare. Antitrust laws also apply to businesses. So basically, you're trying to prevent monopolies. And so the Sherman Act of 1890 prohibited monopolies, which means that one organization cannot dominate a market, which eliminates consumers' choice, and then they can do price fixing. It also targets price fixing among competitors that prohibits a consumer from paying a fair price because the competitors, establish a certain price amongst themselves to stabilize the market. So basically, it's like the competitors, they get together, that's price fixing, and say, oh, we're all going to jack up the price, but we all jack them up together. Everybody will make more money, and the consumers can't go anywhere else because we're all the ones that are just providing the service. That's seen sometimes, if you've seen in emergency, especially remember after 9/11 in New York, there were a lot of gas stations that were accused of price fixing because there was such a need. People were trying to leave, so some people were coming in to help and all of that. And so price fixing, price gouging, that kind of stuff is definitely illegal and can be fined and stuff. The Sherman Act also prohibits the following: market division, which occurs when one or more health organizations decides which type of services will be offered at each organization. For example, to say Hospital A says, we'll do the chemo treatment, or we'll do all the radiation treatments if you do all the chemo, or we'll be the only ones that give chemo, and then the other one would be like, okay, we'll be the only ones where you can go get an MRI. I don't know, something like that. Tying refers to healthcare providers that will only sell a product to a consumer who will also buy a second product from them. So it's like bundling services, but it's like, well, I don't really want this other. No, you have to buy it. That's called tying. That's not adequate. That's not good. And then boycotts is when healthcare providers have an agreement to not deal with anyone outside of their group. It is considered interfering with consumers' right to choose. Okay, so what is an example of services or businesses that are not healthcare related that could be prone to monopolies? If you think of one that's healthcare related, that's fine too if you want to. Can you think of any services around where you live, or things that you like wish you had more choice? I personally can tell you internet, especially if you live in a rural area, those your choices are very limited for internet service. The Clayton Act, it places restriction on hospital mergers and acquisitions. It allows individuals to sue for 3 times their actual damages plus legal cost. The Hart-Scott-Rodino Antitrust Improvement Act of 1976 was an amendment to the Clayton Act, and it ensures that the hospitals and other entities that have entered into mergers and acquisitions and joint ventures have to first notify the Department of Justice and the Fair Trade Commission before any final decisions and final acquisitions and all that are made. Okay, let's talk about informed consent. So informed consent is based on a patient's right to make an informed decision regarding medical treatment. It's a legal requirement in all 50 states, and the provider is responsible for discussing with the patient, 1, the diagnosis if it has been established, if you know the diagnosis, okay? You have to tell the patient you have been diagnosed with cancer. This is this type of cancer that you have. You can't hide it from them, okay? The nature of a proposed treatment or operation, including risks, benefits, alternatives, and the risks and benefits of the alternatives. And then cancer treatment, unfortunately, so sometimes like not getting treatment or maybe doing natural therapies and stuff like that, a lot of cancer treatment physicians don't see that as an alternative, and so they pretty much propose their only solution is their chemo or their surgery and stuff like that. And so that could be a lack of informed consent because you haven't given all the alternatives, because maybe you don't think those are good alternatives or something like that. The risk and benefits of not agreeing to the procedure or treatment. So say, okay, if you want to refuse treatment, then this is what you're looking at, because remember, the patient still has a right to refuse. Okay, so this video is really good about informed consent. It'll make you think. One of the things that we have to be really careful being in the healthcare field is like you develop this jargon, this language that you know what it means, all your other peeps know what it means, but a lot of the times to the patient, they have no clue what you're talking about. And so you have to explain a lot of things to patients, like assuming they're like a 5-year-old, basically. You don't treat them like they're a 5-year-old, but you need to explain it to them on that level. So if a patient did not provide informed consent for a procedure or treatment, then it is considered a case of negligence. A medical emergency may eliminate the need for an informed consent. For example, if a patient cannot clinically give consent to a life-saving medical treatment, then what we call statutory consent may be considered, which presumes a reasonable person would give consent to the life-saving procedure. Then consent may be implied in a non-emergency situation. Also, if the patient volunteers for a procedure, says, yeah, sure, I'll have this done, that implies consent, even without oral or written verification. The patient might be considered to have given then at that time, if they volunteered, an informed consent. So it can be statutory if they're not able, but it would be reasonable to assume that they would, or it could be also implied in just that non-emergency if you volunteer. To determine what constitutes informed consent, there are 2 legal standards that have to be applied, that can be applied. So you have the reasonable patient standard. This focuses on the patient's information needs, including the risk benefits that allow the patient to make a decision. And it needs to be explained in terms that the patient, again, can understand. And then the reasonable physician standard focuses on the standard information that would be given by any physician to the patient that contemplates the same procedure or treatment. So most states utilize the reasonable patient standard, again, focusing on the patient because it's more important for the patient to have all their questions answered, understand exactly what is going on, what all the options are, what each of options entail, risks, benefit, etc., even cost, if that's something that can be given to them. Okay, so give me a barrier to informed consent, something that would prevent a patient from fully understanding what's going on and giving true informed consent. And lastly, we're going to talk about the Patient Bill of Rights. So the Patient Self-Determination Act of 1990 requires that hospitals, nursing homes, home health providers, hospices, and managed care organizations that provide services to Medicare and Medicaid eligible patients, they have to supply information on a patient's rights to the patient upon admission. So that's usually one of the many forms that you sign when you're admitted into a hospital or nursing home or home health or whatever. And it applies to virtually every type of healthcare facility. And the facility must provide the adult patients with written information under state law about making healthcare decisions. And sometimes they'll hand it to you in the form of a packet. Sometimes they'll be like, here, you can have access to this information. This is where it's located. Do you want to see it? If you don't want to see it, assign this is where you find it. But then you sign receipt that you acknowledge that you've been made aware of that. So it's based on the concept of informed consent. Then in 1972, the Board of Trustees of the American Hospital Association developed the Patient Bill of Rights. And the Patient Bill of Rights states that the patient has the right to all information from his provider regarding any testing, diagnoses, and treatment. This information has to be provided to the patient in terms that the patient will be able to understand. So you really do not want to use medical jargon, medical words. You want to dumb it down unless you are absolutely certain that maybe you're talking to a peer that really understands what's going on. So in conclusion, to be an effective healthcare manager, it's important to understand all these basic legal principles that can influence the work environments, including the legal relationship between the organization and the consumer. As both a healthcare manager and a healthcare consumer, it's imperative that you're familiar with the different federal and state laws that impact a healthcare organization. It's also important that you understand the difference between civil and criminal law and the penalties that may be imposed for breaking those laws. Especially, you're going to see in your homework about HIPAA. You better understand that one really well, because if you violate it, it's criminal, federal crime. You can become a felon and be completely banned from working in healthcare. Very important to understand those. New laws have been passed and older laws have been amended to reflect the needed changes regarding healthcare to continue to protect participants from a patient and an employer-employee perspective. Some of that is going to be reflected also more in your homework. All right, and if you have any questions, you may list it there, and I thank you for your attention.